Hello everyone, today our group will be presenting our recommendation for an EHR system based on evidence-based research and the needs of our modern healthcare organization. So throughout this presentation, we'll discuss the key features that we've identified and explain why we believe that it is the best choice for meeting both patient care and organizational needs. So one of Cerner PowerChart's biggest strengths is its clinical decision support system. Instead of providers having to manually analyze every lab value, medication, and vital sign, the system continuously reviews that information and provides evidence-based recommendations. It also acts as a safety net, alerting providers about potential problems before they become serious. For example, if a patient is prescribed 2 medications that could interact, Cerner immediately generates an alert so the provider can reassess the order before it reaches the patient. So these built-in rules help support clinical judgment, but they don't replace the provider's decision-making. They just make it easier to catch these potential errors so we can improve patient safety. Another feature that helps providers and healthcare professionals in general is Cerner's power plans. These are pre-built order sets based on hospital policies and evidence-based guidelines. So rather than entering every individual order from scratch, providers can select the power plan that fits the patient's conditions best and kind of customize it as needed. And we're talking also about the discern alerts, which work like an early warning system. These notify these providers when a patient's condition may be worsening, or maybe when there's a medication safety concern before it reaches the patient. Together, these power plans and discern alerts help standardize care and improve efficiency and support faster clinical decision making. So Cerner also uses data analytics to improve patient care beyond individual patient encounters. For example, population health analytics allows organizations to identify health trends across like a larger group of patients so that we can intervene earlier when risks are identified. On an individual level, diagnostic tools analyze lab results, vital signs, and other clinical data to help providers recognize changes in patients' condition, like acute or chronic. Research has even shown that organizations using Oracle AI with Cerner data were able to reduce sepsis-related complications. So just those trigger values on those kind of lab sets and helps identify those potential health concerns a lot earlier. And then in addition, workflow analytics also help hospitals monitor operational performance, such as admissions, discharge times, and identify opportunities to improve efficiency. So now we move on to practice management. This slide is for coordination, scheduling, and billing. Cerner isn't just for beneficial for clinicians. It also improves the day-to-day operations throughout the organization. With that being, it streamlines the registration, appointment scheduling, and insurance verification, ultimately reducing the workload for front office staff and preventing those billing errors before it happens. Patients also benefit through the Healthy Life portal, where they can schedule appointments, complete paperwork ahead of time, all those screening forms, and communicate with their healthcare team. Kind of just improves that process even before they're in the office or in the waiting room. And behind the scenes, Cerner connects clinical documentation directly to the billing process. So all of those ICD codes gets documented, and as providers document the care they've delivered, the system can automatically capture those services for billing. Checks claims for errors before they're submitted, reducing denials, and improving reimbursement while avoiding like any duplicates and unnecessary costs. When it comes to reporting and analytics, Cerner also provides powerful reporting and analytic tools that help organizations monitor their performance and improvement quality. So these are things that usually nursing leadership looks at, like collapses, CAUDIs, falls, pressure injuries, data like that. That data can easily be exported into reports or programs like Excel, making it easier to identify like trends, evaluate outcomes over time, frequencies of these hacks or hospital-acquired conditions, as we so call it. The system also generates reports needed for regulatory compliance and helps them monitor like their quality and safety measures. So another advantage is standardized order sets based on the evidence-based practices that we've talked about earlier on. So these templates can reduce the variation in care and minimize the medical errors and promote more consistent patient outcomes. So if we were to standardize like the frequency of assessing an infusing line for like a PIV or a central line, that will be part of those power plans or order sets that we can have in Cerner. Cerner also supports hospital leadership by improving administrative workflows and functions. So it can identify peak admission times and staffing patterns, so that managers can create more cost-efficient staffing schedules based on patient volume and just the demand of the unit. It also maintains a detailed audit through that digital signature by recording every medication administration. So auditing becomes a lot easier because the documentation has the date, the time, the user who completed it. It improves that accountability through every point of care. And then finally, PowerChart also provides a complete clinical timeline of a patient's hospitalization or even their outpatient visits. It makes it easier to review the course of care without spending hours and hours of notes and charts of consultations, outpatient appointments, telehealth, and all that. Kind of just gives you a picture of how we got to X, Y, and Z. So overall, Cerner is a strong evidence-based EHR that supports both high-quality patient care and organizational goals. Its cloud-based platform reduces that long-term maintenance costs, but also provides us the flexibility to grow as the healthcare organization expands. The clinical decision support tools improves patient safety. It streamlines documentation and enhances communication between providers across primary care, specialty services, behavioral health. And when you combine those features with its operational efficiency, Cerner becomes very well-rounded for a good solution for a large and diverse healthcare system. So another reason we recommend Cerner is its ability to support diverse patient populations and improve health equity. The system captures more demographic information such as like race, ethnicity, preferred language, disability status, gender identity, and social determinants of health, allowing us to better identify disparities and develop targeted interventions. Cerner's patient portal also improves accessibility, offering multilingual resources, mobile-friendly tools, and even patient education handouts written in plain language. So these features help us improve health literacy and make healthcare information easier for patients to digest and understand. Cerner can also expand access through secure messaging and remote monitoring, which can be very valuable for patients who have transportation challenges, mobility limitations, or just other barriers to receiving care. Cerner also has that interoperability that allows information to be shared across hospitals and clinics and community providers. So say you have a different primary care clinic, we can share that information and help reduce that fragmented care and improve coordination for patients with a lot of complex healthcare needs. So through the HealthLife patient portal, patients can securely access their medical records, review their test results, and schedule appointments, even request prescription refills from their healthcare team. This patient engagement through digital care gives patients easy access to their health information, which in turn also encourages them to take more of an active role in managing their care. So it supports, Cerner integrates telehealth, which allows them to connect with providers at home, especially for those individuals who live in rural areas or, like I said, the transportation challenges. Just added the convenience of connecting with the provider. Of course, it doesn't completely replace the value of a physical assessment in person, but it just kind of bridges that gap. And the system provides personalized health education. So whether you're in the mobile app or you're on a desktop or a laptop, you can have easy access to education materials, medication reminders, and even preventive care notifications, which can improve medication adherence and health awareness and just encourage patients to stay engaged between visits. Overall, Cerner's patient engagement features strengthen the communication and access to care, which supports better long-term health outcomes, keeping us connected with the healthcare team. And that is it for us. Thank you so much for listening, and I hope you have a great rest of your day.